My name is Shane Foley. I am the head of subject for radiography in UCD, and I'm just going to spend the next kind of 15 to 20 minutes really introducing you to our radiography program, but also more importantly, the life of a radiographer in terms of a career. Okay, because this, I suppose, has a significant weighting for especially school leavers as they're considering potential careers and pathways, especially going to third level. So I suppose just to give you a small bit of background on myself, I studied in UCD back in the late 90s, and I worked for about 8 years as a radiographer in the Mater Hospital in Dublin before coming to UCD. And I've been lecturing here in UCD now for approximately 14 years or so, and I'm currently the head of subject. So I've got a academic oversight of most of our programs. So we have an undergraduate program, which is our largest program, and into that we have 100 students per year across our 4 years. We also have a graduate entry program, which takes smaller numbers of 20 to 25. And then we have a range of postgraduate training offerings, because we have traditionally been the national training centre for radiographers in UC. So we provide a lot of the postgraduate training and education opportunities as well. But back to, I suppose, our main focus today, it is our 4-year undergraduate program. So I suppose just to maybe start at basics in terms of what is a radiographer, because again, you may have come across a term, you may have a lot of insight into the role, but just to make sure we're all on the same page. So radiography is actually the performance or taking of diagnostic images of patients to help with diagnosis, treatment, and follow-up of disease. So radiographer is, I suppose, the umbrella term that we apply for a number of different roles. So we actually have a diagnostic radiographer, which are those health professionals who essentially image patients to help detect the disease and to watch their treatment and follow up. And then, but there's also a separate branch, well, a slightly separate branch in Ireland at least, because we have there is therapeutic radiography as well, and this is not done in UC. So it's just really to be clear for everyone in terms of differences between the two. Therapeutic radiography is actually done in Trinity in Ireland. In other countries, especially in Europe, often both these courses are combined, and students or graduates can enter both aspects of the profession. But in Ireland, UK, they are separate. So therapeutic radiography principally is involved with cancer treatment. So when patients get a diagnosis of a cancer, sometimes the treatment of that cancer is to essentially hit it with radiation in the attempt to either shrink that cancer or to kill off those cancerous cells. So the main differences between two arms of the radiography professions, I guess, or branches, is that therapeutic radiographers tend to see the same patients over the course of 6-7 weeks, so regular contact, longer sessions, whereas with diagnostic radiography, you tend to be working in the acute setting with a different patient every 10 to 15 minutes, and then working across different areas of hospital. A number of students or potential students also ask us this question: well, is radiography the same as radiology? And just to be clear, so radiographers perform the imaging, meet the patients, deal with them, try to create the diagnostic images on the back of it, but it is then a medical doctor who looks at those images and interprets them, and that is a radiologist. So to be a radiologist, you'd first do medicine and then do an additional 5 years of training specifically in radiology. Okay. So coming back to radiography and diagnostic radiography, which is our focus in UCD, there are obviously many aspects to it. You're principally involved in a healthcare setting, although more and more now it is not so much based in hospitals as there's an increase in private imaging clinics and smaller imaging clinics that are not dependent or have to be located within a hospital. But principally, it involves patient care, because again, it is, I guess, the marriage of technology and science with patients. So using equipment, various technology features to try and get the best images we can to help diagnose a patient and put them on their, I suppose, care pathway. And all these are essentially blended into the profession of diagnostic radiography. And with that in mind, obviously you will encounter and experience the whole gamut of patients from all different ages, from pediatrics right up until centenarians. Also, you'll meet a lot of patients in the acute medical setting. So you'll have patients coming in straight off an ambulance who are after being in an emergency trauma. You'll have patients in the intensive care ward, because again, we have to go and do a lot of mobile radiography up there. There is a lot of theater-based radiography, and more now we're doing interventional radiography, where minor, small invasive or minimally invasive examinations are performed on patients, such as angiography or stent placements, etc. So it does involve meeting essentially the whole population in terms of will be your patients. The technology too is quite varied and different. Obviously, all of our technology comes with a range of software and different settings. We have our most basic technology would be a simple X-ray, but then we have very, very advanced technologies such as the latest CT or MRI or even PET scanners, and some of those equipment can cost millions. Okay, so we're talking about anywhere between 2 and 4 million for a modern MRI scanner. So you are trained to use and to carefully drive these equipment to make sure you get the best out of them and hopefully benefit your patients maximally. So just to give you an idea of the types of, I guess, technology that we do use in diagnostic radiography, because again, these form part of your education in UCD as you go through the different years. So obviously starting and spend a lot of time on the basics of simple X-rays, because again, these are a mainstay of imaging where we take essentially a two-dimensional image of a patient. They can help diagnose a plethora of problems and clinical issues. Similarly, we use 2D X-rays in mammography. We take X-rays of the breasts, either where a patient is symptomatic or for asymptomatic in a screening side, where patients, I suppose healthy people, are invited to image in the hope of trying to detect disease at a point where it hasn't become symptomatic yet. We use live X-rays, okay, slightly more technical and advanced, whereby we want to monitor things that move within the body, or even see how, I guess, either blood vessels work or even the digestive tract. So we can ask patients to drink metallic substances first, and you can see on screen here, we can literally take X-rays and watch it on a second-by-second basis as that fluid goes down the digestive tract, and that can be very helpful for diagnosing various disease processes. Next, something most people are familiar with is that of ultrasound. So ultrasound does not use X-rays; it instead uses high-frequency sound waves. So no radiation is involved, but again, we use this to essentially build up echoes or pictures based on echoes of the human body, and it can be really, really useful tool, especially in obstetrics, and that's why most people will be familiar with it. They're for pregnant females when they're coming for their checkups. They'll often have ultrasound scans to check on the health of the baby. But not just in pregnancy. We also do it, and again, this is all these images I'll show you here are just samples from a pregnancy scan, so we can see the blood flow in a heart of a fetus here, and even three-dimensional imaging of a fetus as well. But ultrasounds are much more versatile than that, and are actually used across the range of imaging exams of the whole body, ranging from the abdomen, the heart, and more and more now in the musculoskeletal imaging. So even in I guess a lot of the premiership or elite sporting teams will often use ultrasound as their mainstay to look for disease for muscles or tears or tendons, etc. Angiography is a type of fluoroscopy we use, but again, it's becoming more and more commonly used in radiology. So again, we're using X-rays to watch blood vessels live and watch fluid, or here you can see some contrast. So it's black fluid going into blood vessels in the brain, and we can watch that as it flows around the brain, and again, look for blockages or any abnormalities. CT scanning, or CAT scanning, as is often known, is, I suppose, one of the workhorses of radiology. And the fact that, again, we're using X-rays, but we are using X-rays to produce slices of the body and produce a lot more detail than a simple X-ray does. And these images are fabulous in terms of the level of detail we get. We can get detail as low as 0.3 of a millimeter using CT. And as you can imagine, this is amazing for detecting the disease at an earlier stage, to seeing exactly the extent of that disease, and hopefully to develop a plan for the patient's care and treatment after it. And you can see some of the images that are produced on the back of that. So we can actually produce these amazing three-dimensional images of the body, which will essentially allow us to look at the body, to help out the mind's eye to visualize the body a lot better, a lot easier than sometimes can be done. And again, we have a picture in the bottom left of the heart, because again, the CT can image the heart while it's beating and watch blood flow circulate around. And again, this can avoid the need for a patient to have some more invasive examinations, such as perhaps coronary angiography examinations. MRI is, I suppose, one of our most expensive tools. Again, it doesn't use radiation, similar to ultrasound. Instead, it uses a large, very powerful magnet to produce 2- and 3-dimensional images of the body. And again, it does this with amazing detail, and we can get amazing insights into the brain in particular, and the spinal cord, as well as various joints and musculoskeletal injuries. We can even watch anatomy as it's moving and working functionally. So we can see here the heart as it pumps, and we can see blood being pumped from the the left atrium and left ventricle, and then out through the aorta. Nuclear medicine is again a branch of radiography, but it's slightly different. Instead of sending X-rays at a patient, we instead inject the patient with a radioactive material. Give a bit of time for that to settle in the body, and we essentially measure the radiation that that patient gives off. And this can give us great insights into the functioning of the body. So this gives us more information on physiology as opposed to anatomy. And here are just 2 examples of images that result from that, where we can look at the lungs. We ask a patient to actually inhale, to breathe in a radioactive gas. And you can see the normal image on the left, with essentially that gas has gone to all parts of the lungs. But in the image in figure 2, you can see that there's some areas of lungs that are not getting any of the gas. So again, what's going on here? What's obstructing it? What's blocking the gas from entering? The image on the right then is actually essentially, it's almost like a stick drawing of the body and the skeleton. And this is actually what a typical bone scan from nuclear medicine provides us with. So it doesn't look that detailed, but what it does tell us is what parts of the body are working harder than others. So again, we can help detect disease a lot earlier, sometimes than X-rays or CT or even MRI. Lately, we've had a lot of technological development. So in radiography, we have newer and newer equipment, and this happens repeatedly. So even throughout a 4-year program, we often have to teach our students new devices, new technology is coming in place, because again, the world of imaging changes so frequently. One of the more commonly used of these new tools is PET imaging, or positron emission tomography, and that's often coupled with a CT scanner. So we bolt a PET scanner onto a CT scanner, so we get the detail of the anatomical structures and then the functional detail from a PET scan. And we marry these 2 together onto the same image, and we get this kind of color-coded map, which again gives us a lot more detail on whether tumors are active, benign, malignant, etc., etc. So that's I guess the various areas that radiographers can work in, especially in the acute medical side. Just to dwell a small bit on the course itself and the program. So the UC program is split generally into a range of subjects. So we have practice subjects, which teach you about the practice of radiography. So in other words, how to take and perform all these imaging tests. We have our own radiography skills lab, which you can see in the top left corner. It's also my background here, where our students can go in and get hands-on practice and use the equipment. Obviously, they won't be taking X-rays of each other, but they will be using it to get a feel for how the equipment moves, and they can also take X-rays of phantoms and different objects that do it safely. We're very lucky as well in recent years to now have virtual reality radiography. So you can see one of our students wearing a headset, and they have hand controls. So they're essentially put into a virtual reality X-ray room, and they can move around that, interact with a patient and the equipment, and take X-rays and see what they look like, as you can see in the bottom left. About a third of our program in UC is with clinical modules. So where students actually are not in UC, but actually placed in hospitals around Ireland, putting into practice everything that we've taught them in UCD. And this is a key part to ensure that our students, when they graduate, are ready to start working from day one, because they have their apprenticeship done throughout the 4 years of the program. Other aspects are technology aspects, because as you've seen, there's a range of technology and equipment that radiographers have to be familiar with, know how to not just use, but also get the best out of and optimize. So we take you through all those technologies, how they work, the various features of them. And then the last set of subjects would be our generic, I guess, healthcare subjects or medical subjects, where you are taught anatomy, physiology, often with the medicine students or physiotherapy students. Even legal medicine is also shared with physiotherapy students. So there's a range of subjects that you take over the course of the 4 years. And a typical day in UC is also generally a combination of lectures, but also with tutorials, because again, the practical training is an essence of radiography, because it is a skill, a clinical skill. So we build these in to your timetable. Also, we have practical sessions, like I said, in the virtual reality room or with our computer technology. And there'll also be some computer-aided sessions where you'll be essentially looking at X-rays or in our image labs or our computer labs and working with them. Then for those students who, when they go out in placement, so obviously our placement varies from year to year. So we start with only 4 weeks of placement in first year, going on to 9 weeks in second year, on to 13 weeks in third year, and 14 weeks in fourth year. So you can see it builds every year. And a typical day is where a student is rostered or rotated through a specific area in radiography or radiology. Typically, radiographers themselves spend 2 weeks on each rotation. So they'll spend 2 weeks in general X-ray, 2 weeks in the emergency department X-ray, 2 weeks in CT, 2 weeks in MRI, etc., etc. So it is quite varied, and that's important that we replicate that as well for our students, so they can see the essence of how radiographers work and the various tasks they have. Also, obviously, because it's mostly in the acute setting, sometimes you might be asked, rotated to one area, but you may have to help out in another area as and when needs demand. We do have a nationwide network of hospitals, so we place our students in hospitals throughout Dublin, but also as far north as Letterkenny to Mayo and down to Cork. Okay, so it's all over the country to make use of all the best clinical facilities in that we have in Ireland. We also have a clinical practice tutor network where we have clinical staff who are there specifically to help and train our students. Now, this is quite a busy slide. Don't worry too much about it. This is just essentially a one-pager outline of the radiography program. All the various subjects that students take in the different years. So you can see there's stage 1, 2, 3, and 4 are different years. We have different trimesters, so autumn and spring. And I suppose just the key things to note in this, in each year you tend to have practice of radiography modules, technology of radiography modules, and then you have your other modules as well as clinical practice. One thing to note about clinical practice is obviously some of this clinical practice takes place outside of the main semesters. So we have to send our students into placement throughout the year. So sometimes that can occur during the break weeks from the university, and also sometimes in the summer period. In first year, just to give you a quick idea, here are some of the first year subjects that are undertaken and what's involved in them. But again, all this information is on our website, and you can scour there and get a bit more of a understanding of what's being covered. Just to note a few of the unique features of our program, but also being fortunate to be part of the UCD system. We're a key partner in Erasmus, so our students have an opportunity in their final year to spend a 3-month period in another European country. And in that, you can see the countries listed here. That 3-month period, they have a course of education, but importantly, they spend 6 to 8 weeks working in hospitals in these countries to appreciate how radiography operates and to, I suppose, gain extra skills and insights into that, and to understand at a European level, I guess, ways of doing things. We also are lucky to have a few student research programs in place where our students have an opportunity to spend time abroad as well, either in Dublin, where we have a very successful student research system, but also to go abroad. So we have links with a university in the United States where our students can go for a period of 4 to 6 weeks and undertake research. Few pointers on why study radiography in UC. Well, we are the National Training Centre for Undergraduate Radiography. We have amazing facilities. We have brand new X-ray rooms. We have brand new virtual reality. So it's essentially cutting edge equipment and setup we have. UC, as you well know from today's visits to the different areas, has an amazing university life in terms of student facilities, ranging from the sports centre, cinemas, teams, various clubs and societies, as well as the on-campus facilities. In terms of radiography, just some other interesting aspects of the future. People often ask us in terms of job prospects. Job prospects have actually been excellent for many a year in radiography. So all our students get employed, typically even before they get their results of their degree. Okay, there's such a demand. That's one of the reasons why we've increased the number of students from 50 to 100 at present. It is very much an international career because radiography is used throughout the world. So many, if not nearly all of our students tend to go traveling with radiography and maybe spend a year in Australia, New Zealand, America, the States, South Africa, working as a radiographer, okay, and getting all that life brings with it in those countries. Just a few pros and cons as well, because I think it's important to put it out there. Some advantages you can see listed on screen, but also some potential disadvantages. Again, it is a very specialized education, but it is a Bachelor of Science in radiography. So it is a general Bachelor of Science degree as well. So it does open many doors. Some people dislike the on-call hours. So again, radiographers, because you have to service the healthcare system on a 24/7 basis, there is some on-call requirement. But I would stress that if you are people focused, like interacting with people, especially patients and all the range of other staff you'll meet, it is a very varied working life and very interesting, and it keeps you motivated at all times. If you are thinking, is it for you? Please do consider some of these. So sometimes, maybe less so at the moment with COVID, X-ray departments where you could actually spend a day or two in an X-ray department to see the workings of it. But if that's not possible, do make sure you talk to graduates or qualified radiographers, get their opinion on it, ask them questions about what interested them in it and what motivated them, or maybe check out some of your reasons. You can also talk to me, so I'll be taking questions in a chat room after this if there's anything you want to ask. We also have a social media channel, so you can look up on YouTube or on our website, and you can look at some of the videos there, hear from our previous students, what they think about it. There is plenty of general information about radiography online. Use it. Okay, and by all means, feel free to ask us any specific questions you have. We have an email address here, which is diagnostic.imaging@uc.ie, which you can send any specifics to questions about our program. So please feel free to do that. And that's it.